So Tom and I are, in the context of this project, interested in what persuades people to change their behavior in response to COVID-19. Our basic starting position is that many of the actions that people are being asked to do are not actions that they were doing prior to COVID-19. And therefore, sort of one of the core questions for us is what would cause them, persuade them to actually take a change in action such that they comply with or follow the advice of experts. And so our key question here, what leads to that behavioral change? And the sort of starting point for where we're thinking about this, drawing on a variety of different literatures from different fields about persuasion, is that people need to learn from a persuasive information source to be convinced to change their behavior. And that then, of course, raises the question about what actually counts and how do we explain persuasion? So the starting point, again, is that changing in beliefs or behavior requires persuasion. Persuasion, we argue, well argued by others, right, requires information. So if we're going to ask people to change their behavior, whether it's about wearing masks or it's about interacting with non-co-residents or something along those lines, requires that they have information about what they should be doing. People have to actually acquire information, however. Information acquisition is costly, both in a real sense, but also in an opportunity cost sense. And so therefore we focus on what will cause them to have the incentive to actually acquire information. And we've done work along with others showing some different factors that can create this incentive. And sort of the two incentives that we focus on in this paper are anxiety as sort of a psychological mechanism that can create an incentive to acquire information, or material or financial effects. So for instance, if you own a business in which you're worried about the financial effects of COVID, you may be more likely to acquire information about how you would go about reducing the effects of COVID, either in your own business or in your own life, sort of because there's a financial reason to do so. And then, so if you're going to acquire information, the next question is, well, what will it take for information to actually persuade you? Because of course, we all know that lots of us acquire information that we don't find persuasive. And the basic understanding of this is that the information must come from a trusted and knowledgeable speaker or source. So here, then what we're looking at is, do people perceive the sources of information that they go about and acquire to be trusted and knowledgeable? And that then leads us to sort of put these pieces together into two different hypotheses that we then seek to investigate using a couple of different data sources. So the first hypothesis is individuals who experience the effects of COVID-19 will be more likely to be knowledgeable about the disease than those who do not experience its effects. And then individuals who experience the effects of COVID-19 will be more likely to trust official sources of information than those who have not experienced such effects. So in both hypotheses, what we're looking at is what causes people to become knowledgeable and trusting of official sources of information because of the results of, or because of experiencing some effects of COVID-19, or at least anticipating such experiences. And I'm going to go briefly, you can read this. I want to make sure Tom has time to actually talk about the data. So let's turn now over to Tom, who can talk about our actual data analysis at this point.
Thanks, Nick. As mentioned by Nick, we have two different data sources, both using national probability samples and both kind of surveys. The first is a survey conducted by the Kaiser Family Foundation in mid-March, from the 11th to 15th of March, so just as things were kicking off. And we have we have about 1,216, or actually exactly that number, who participated in the survey. And the variables we look at as DVs for this include the knowledge of symptoms and experts' recommendations, the trust in the CDC to provide reliable information on COVID-19, and protective behavior. So for knowledge, we gathered a whole bunch of symptoms and expert recommendations about protective behaviors, and then we rescaled that variable for the correct answers into quartiles. So we use similar variables in the UAS USC survey. Here we have a larger number of observations, but it varies by wave and what questions were asked. So again, we used a knowledge measure that captured symptoms and the effectiveness of protective measures, trying to match up those variables as much as possible. We also use Trust in CDC to provide reliable information on COVID-19. And behaviors, we used the measure of protective behavior conducted in the last 7 days. So this is things like wearing a mask and social distancing, etc. In terms of independent variables, from the KFF survey, we looked at income loss as one particular material effect. So this is where the participants indicated that they'd lost income from a job or business, and also their self-reports about whether worry or stress had impacted their mental health. We used similar variables from the UAS survey, where we asked them to perceive or the survey asked them to estimate their chance of job loss, and then we rescaled this into quartiles, and we used an anxiety measure about the number of days spent feeling anxious in the last 2 weeks. So in terms of our results, from the KFF survey, we used a host of control variables. From the KFF survey, we see that there wasn't any kind of effect or statistically significant effect of our incentives on knowledge or the trust in the CDC, but we do see that it's positively associated with protective behavior. For the UAS survey, we find things that are slightly more in line with our expectations. So the risk of job loss and felt anxiety are positively associated with knowledge, although barely. And we also see that for felt anxiety, this was positively associated with trust in CDC. And both measures, again, were associated with increased protective behavior relative to those without these incentives. So in terms of next steps, this is very much a work in progress, but we're working on expanding the survey and our study to include changes over time, mediated effects, and basically try and get a sense of this in greater depth. Thanks very much. Looking forward to the Q&A.